That sharp, deep pain in your hip that only shows up when you twist wrong or sit for too long, it might not be a pulled muscle. It could be a labral tear. Let's find out what's going on with you. First off, let's discuss what is the labrum. We are using our lovely skeleton model here to be able to show you. Now, she does not have a labrum on here, but it helps us to be able to see where it is. So this bone here is your ilium, and this bone here is your femur. This is your leg bone. There's a joint in between here where the femur interacts with the ilium. And right around here, you can see there's this ridge right here. So the labrum is a piece of fibrocartilage that helps to extend the ridge. So actually will make it longer, which helps to hold that femoral head inside that acetabulum. Because it is not bony and it's that fibrocartilage, it can get pinched sometimes. It can be from repetitive stress. It can be because the ilium is not in the proper alignment. It could be due to increased pressure. There's a number of reasons that we can get that impingement that can cause either a hip impingement syndrome or a labral tear. And these tears are more common than most people realize, especially in active women, dancers, and gymnasts. So how do you know if what you're suffering from is indeed a labral tear? First off, you're going to have a sharp or pinching type pain that's in the front of the hip. Second, you'll have a clicking, catching, or locking sensation when you try to move. Third, you'll have stiffness or a decreased range of motion, most commonly due to the inflammation caused by the labral tear. Your pain will usually worsen if you're sitting or standing for long periods of time, or if you twist wrong. And the crazy thing about a labral tear is that some days you'll feel absolutely fine, while others you'll be 100% miserable. And why is that? Why is a hip labral tear not painful all the time? Well, you see, the labrum has limited blood supply and limited nerve endings, which means the pain is dependent upon pressure, and that pressure will be relative to the position. And you may only get that popping or locking or clicking sensation when you're doing certain movements, because they only happen when the femur or the leg bone moves certain ways. And the muscles in the hip can get tight, which can actually draw that thigh bone into that joint and cause increased labral pressure. So tight muscles can lead to a labral tear, which also means if you have a pelvic malalignment issue, that can cause the muscles to tension, which can increase the pressure, which can lead to a labral tear. So many people who come into my clinic have been suffering with a pelvic malalignment issue for a long time, but it was never painful, or they report that it was never painful until they did this one thing and it became painful. Before we discuss what is making it worse, if you are getting value out of this video, please click that like button and don't forget to subscribe for more content on how you can take care of your body. Now, what might be making your labral tear worse? That pelvic malalignment we just discussed, if you are suffering with that in conjunction with a labral tear, it will make it easier to pop or catch or lock, which can then increase your pain. If you have a tight psoas or hip flexor muscle, that's the muscle that's right on the front of that hip. When it gets tight, it pulls that femoral head into that joint, which again can cause that labral tear or aggravate a labrum that's already torn. On the opposite side of your body, if you have weak glutes, those are the muscles in the back of your hip, that will lead to a tight psoas or hip flexor in the front of the hip, which can aggravate that labral tear further. And we're going to get back to talking about those glutes in just 1 second. If you perform a job with repetitive motions, or maybe you went out and did 8 hours of yard work doing exactly the same thing this weekend, those repetitive motions can lead to increased stress to the joint, which can cause a labral tear. Equally, if you sit for prolonged periods of time, that can cause increased pressure to the joint, which can aggravate a labral tear. Now, sitting usually won't cause a labral tear in the first place, but if you did all that yard work on Sunday for 8 hours and caused a labral tear, and then you sat at your desk for 8 hours on Monday and had pressure on that labral tear, you will not be feeling good by the end of the day on Monday. All right, so you have diagnosed yourself with a labral tear now. What can you do at home right now to find some relief? First off, it is super important to make sure that you are in correct postural alignment. And this means when you're sitting that your head is over your shoulders and your shoulders are over your hips. If you're standing, head is over shoulders are over hips and hips are over feet with equal weight bearing through both feet. The next thing you can do is to release your psoas or that hip flexor. And all you need to do is put your hand on the front of your hip, find the spot that's sore, and gently rub on it. Now, I know some people get super aggressive with this and they're like, oh my gosh, it hurts so good and I want to keep going. Do be gentle the first time you try it because we don't want to aggravate any symptoms. Remember that sometimes less is more when you're starting out. The next thing we want to do, now that the psoas is released in the front, we want to activate those glutes in the back. So you're thinking exercises like clamshells, bridges, glute squeezes. You can check out our channel for tons of videos on that, but it will help to get those glutes activated, which will decrease stress on the labrum. And another thing that I really need you to do is to avoid deep flexion of the hip. So flexion is when you're trying to bring your knee towards your chest. This often happens with things like squats. We need to avoid going past that 90 degrees. That would be that femur or that thigh bone being parallel to the ground while this labrum is healing. So we're not going to do squats past 90 degrees. We're not going to do high knee type of activities. We're not going to sit cross-legged while we allow that labrum to heal. We also want to deal with the inflammation that's going on, so we want to use some ice, and we want to use that right on the front of the hip for 3 to 5 minutes, and if you can, we want to do that every hour of the day. We want to decrease that inflammation as much as possible to help that body be able to heal. Once your symptoms have calmed down and you're not having to ice regularly, you're able to do most activities pain-free, then you can start adding in those other activities like squatting past 90 degrees or doing cutting type motions gently and progressing appropriately. We don't want to go from icing every hour for 3 to 5 minutes to the next day it feels better to the day after that we're going to go play soccer at a high level. Gradual reintroduction of activity, friends. Remember, when you're progressing back, less is more. So try adding in a little bit day by day just so you can assess your symptoms and make sure that what you added in the day before is not aggravating you. If you suspect that you have a labral tear, please do not ignore it. Your body is trying to tell you something. Healing starts with restoring balance, mobility, and stability through your hips and spine. Remember, movement is life and your hips are meant to move freely. If you found this video helpful, give us a thumbs up, drop a comment below, and don't forget to subscribe for more content on how movement is life.